Welcome back. It's estimated nearly 80% of cardiac events can be prevented. Yet, cardiovascular disease continues to be a leading cause of death for women in the U.S. Today, we raise awareness by wearing red and sharing vital information by improving our heart health. This morning, Dr. Katie Benziger is with us. Thank you for being here.
Thank you for having me.
You are a cardiologist over at Essentia Health, and you have some vital information for us this morning, right?
Yeah, so today is a Go Red Day for women to help raise awareness about women's heart disease. 50% of Americans have high blood pressure, and many more have high cholesterol and obesity and are at risk of having a heart attack.
Right. And next week we have the annual event to kind of raise awareness for this, correct?
Yes. The Go Red for Women luncheon is on Wednesday, and we have that at the deck every year to help raise money and raise awareness for heart disease.
Now, is this open to the public? Can we come in and raise support?
Yes. It's a fundraiser. You can go to the American Heart Association Northland website. The event, I think, is on Facebook as well. And
sure.
We're going to have a silent auction and lots of great information and some patient survivors telling their story.
Awesome. So it was pretty interesting. You were just talking about Essentia did a recent study, and this isn't just for elderly women anymore, right?
Right. We found in our young women who have a heart attack, under the age of 50, 80% of them are smokers. So really, we're having a lot of young women having heart attacks still, and really the biggest risk factor is that they continue to smoke. So one of our biggest messages is if you are a smoker, really try to cut back or quit if you're able to.
Yeah, definitely. And some of the symptoms maybe for a heart attack, could you list some of those off for us?
Yeah, typically men always describe kind of really a heaviness and chest pressure, but women will often describe extreme fatigue and just really being wiped out doing everyday activities that they used to be able to do. They also report more shortness of breath, nausea, sometimes reflux symptoms, and they take some Tums and it doesn't go away. Those can all be signs of a heart attack.
Another big thing, too, jaw pain that I noted on the website, right?
Yeah, so a lot of times the pain will start in the chest and kind of move up into the jaw and sometimes down in the arms as well.
Sure. So if we're experiencing symptoms, what should we do right away?
So yeah, I think one of the most important things, if you think you're having a heart attack or a stroke, is to call 911. A lot of people think that they should just drive themselves to the emergency room, and by calling 911, you activate all of our teams to get started and get brought in earlier and not waiting till you actually get to the ER. And the ambulance can actually give you some medications to help your pain and symptoms and sort of get treatment started early. So I recommend calling 911.
Helps the hospital plan ahead too, right? And we also worry about stroke with this as well, correct?
Yeah, there's a lot of the risk factors for heart disease are the same for stroke, and women also have strokes similar to men. One of the big risk factors, again, is high blood pressure. So making sure you get your numbers checked, know what your blood pressure is, know your cholesterol. If you have diabetes, make sure that's under control. Symptoms of stroke are more facial droop, numbness, one side that's weaker than the other.
Sure.
Again, call 911 if you're having those symptoms.
Definitely. So maybe lots of young women watching this morning, what age should we really start checking all these different vitals, would you say?
That's a great question. I think if you have a strong family history of heart disease in your family or high cholesterol, there's really no age that's too young to start checking. We routinely recommend checking kids aged 8 to 11 for high cholesterol. I noticed, my pediatrician starts checking my kid's blood pressure. I mean, I think, in your 20s for sure, you should know if you have high cholesterol or what your blood pressure is, and just go to your primary care doctor on a routine basis. It's just good for your heart health.
Awesome. Dr. Katie, thank you for your tips this morning. We appreciate it.
Thanks so much.
Yes. Now let's get a check of the forecast.